The following session will look at the record of neonatal resuscitation and the documentation. This is a pilot study that is now being completed within RJMS in the specific areas of delivery suite and admissions. It's for those situations where there's prolonged newborn resuscitation, where a paediatrician or neonatologist need to be present, or in high-risk deliveries. We're asking midwives to be involved in this. Although the neonatal team may be present, maybe a midwife may be the person who does the documentation. So it's good to be familiar with this. And I'm going to go through this record sheet with you now. As you can see at the top of the record of neonatal resuscitation, there's delivery details. Obviously, during an emergency or where there's a neonatal resuscitation, you will not be filling that in right away. There's also a space for an addressograph label, which you can put in as well. APGAR scores can be recorded here as well. And on the next section, we will be recording things like, was the baby dried and wrapped? Was the baby placed in a plastic bag? Was there meconium present at birth? Was there delayed cord clamping? Did the baby have a hat on, and did it require any suction? The next part of the sheet is recorded at every minute of age, and you can see down the left hand side of this column, at birth, 1 minute, and it goes right through to 25 minutes of age after birth. The first column, as you can see, what we want to record is when did the baby first cry or gasp, and you will record that at whatever minute of age that occurred. Did we get chest lift, i.e. we give inflation breaths, were they successfully given, and did we see chest lift, and at what minute of age was that recorded and seen. Then we're moving through our resuscitation algorithm. Did you see ventilation? Did you go on to ventilation breaths? And that will be recorded here. The next column is your PIP and your PEEP. Your PIP and PEEP are your inspired and your expired pressures. They're set on the neopuff. And what we want to do is record what were the set pressures at resuscitation. Did they need increased or decreased during the resuscitation? The next column is FiO2, and that is your fraction of inspired oxygen. What percentage of oxygen did they start resuscitating at, and did that need to be increased or decreased during the resuscitation? What was the heart rate, and again recording that at each minute of age. And what were the saturations? That may not be available immediately at birth, it may be a minute or two later, but then you would record that at what point that was available. The next three columns are about intubation. So was there an intubation attempted, and what was it successful? And again, at what minute of age did that occur? A neostat was used. Was there a colour change? So if the ET tube is placed in the trachea, there should be a change of colour with the neostat. However, I should make you aware, if there is no cardiac output, if the ET tube is sitting in the trachea, it may still be in the trachea correctly and there may not be colour change. So you need to be aware of that. At what stage did you start chest compressions, or at what stage did the member of the team start chest compressions? Was there a nasopharynx, or was there an NG tube or an orogastric tube in situ? And was there an umbilical venous line inserted, and at what point was that inserted? The final column will record the drugs and at what minute of age they were given. This sheet is double-sided, so if you go through, we go up to 17 minutes on the first side, then we move on to the next side, and we follow right through up to 25 minutes of age. There's another box where we can put any significant findings in, for example, were there dysmorphic features there, what was the temperature, or were there any other procedures completed, for example, did we need emergency O-negative blood? The next column is more about an adjunct to your learning to know what to give. You may well be the person who maybe double checks some of the drugs or some of the fluids that have to be administered to the baby. So this is a dosing regime. So example, what dose of adrenaline do I give the baby? How many mils per kilo? And it's set out nicely in the table here. Cord gases are often available, and if we do have those, they're good to record, so your venous and arterial blood gas samples. And then what is the percentage to be sent off. The last part of the table is all about who was present at the delivery, what was their grade, and for them signing. Before the baby leaves, was there 2 armbands applied? Was there a discussion with the parents if possible? And at what time was the baby transferred from either delivery suite or admissions to the neonatal unit? So we're asking you to be involved in this. Make yourself familiar with this sheet. If you have any questions, I'm more than happy to answer them for you. But if you go through that, so that if you are at a resuscitation and you happen to be the person who's asked to document or be the scriber, this should be useful. We're hoping this sheet will all be useful for all the multidisciplinary team, that they can take it away and we have good documentation of what happened to the baby at various minutes of age during the resuscitation. I would ask you also to be familiar with the e-learning resuscitation package, which is available to you now. And we hope again in September to be starting back to our neonatal resuscitation mandatory face-to-face. Thank you for your time.